Right. Dr. Berndt Schmit, thank you so much for your time this morning. Really excited to talk to you and learn more about your perspective about what's going on with this global pandemic.
Sure, yeah. Hi, Courtney. Um, Glad to be with you on this beautiful morning. It's hard to tell that there's actually a crisis going on.
Definitely, yeah. For the folks, can you give us just a brief snapshot of your background and the different areas in which you worked?
Sure, yeah. My name is Berndt Schmit. I'm a board-certified radiologist. I'm a full-time faculty at University of Arizona. I was trained in musculoskeletal radiology, but now work full-time as an emergency radiologist and actually started our program there last year.
Excellent. I'm also really interested in learning more about your work with Humanitarian Radiology Development Course. So if you can just give a bit of background about that as well, that'd be great.
Sure, yeah. So I started working in third world countries, let's say 4 or 5 years ago, and rapidly got experience with, if you're doing radiology work, we're very equipment intensive and infrastructure intensive. And so kind of migrated from I'm going to these countries to do work or educate people there to realizing we had to help build their capacity to do radiology work. And the kind of soundbite that's really well for us is we're teaching people to fish who didn't have fishing poles. So we started to transition into the idea we have to help them build fishing poles, maintain their fishing poles, so to speak. And so we started Humanitarian Radiology Development Corps 2-ish years ago, and we work now mostly in Haiti, but we also have completed projects in Bolivia. We're ramping up projects in Nicaragua and Ghana now. And we have a pretty large focus on donating ultrasound equipment and then doing the associated training to help the client become functional with ultrasound service. And we're tiptoeing into much bigger projects. So one soundbite is we're basically building imaging centers and radiology departments in the developing world. Very challenging work, very fulfilling work. I think what we're trying to do is grow our Rolodex of contacts of people who can donate their time or institutions that can donate equipment so we can do this heavy scale work that we're doing.
It's amazing. Yeah, thank you. Thank you so much for the background, and thank you for the work that you're doing. We really identify with that and think it's really important. So yeah, so I wanted to just kind of pick your brain really briefly today, and wondered if you could, by any chance, as a healthcare expert with over 20 years of experience and practice, what do you want the public to know right now about the COVID crisis, and especially from like the radiology standpoint? What are you seeing, and what do you want us lay people to know?
Wow, that's a wonderful and large question. I think so much is changing, so much is evolving. This is unprecedented, as everybody is saying. I guess I just wear my radiology hat. There's a lot of debate within the field of radiology of what our role is as imaging specialists. So you have some organizations and people saying, wow, there's nothing super specific about the appearance of COVID on chest film or on CT scans, even ultrasound. And so our role should be a limited role. And then you have information out of places where we're doing a lot of work with COVID. So the Italians, the Spaniards, the Chinese, and they're using a lot of CT imaging. They're using a lot of bedside ultrasound. And I think there's maybe some confusion or some clarity that developed around concepts of triage. The idea you may not have a diagnostic imaging modality, yet you can use that imaging tool for management purposes or true triage. So the concept of triage, maybe it's sort of a grim concept. Triage really becomes relevant when you don't have enough resources. And essentially, the physicians in charge have to make the really difficult choices about who get resources or not, which is a very uncomfortable way of saying some may have to die. So, a lot of our country, fortunately, isn't at that level, but I think we're starting to see that in New York. I'm pretty sure other countries have seen that when their system gets overwhelmed. And I think that's where, putting the radiology hat back on, if you have a CT scan, yeah, it may not be specific for do you have COVID, but if it shows tremendous amount of disease, well, we know that's probably a sicker patient, and it's reasonable to make the assumption that that person has a poorer prognosis. And so if you're faced with, let's say, 2 30-year-olds who have disease and one looks really bad and you only have one ventilator left, this may help inform how you use that resource. You may decide to use the resource for the sicker patient, or you could imagine if it's bad enough, maybe that's a reason not to give that person that resource. So I think it's a, imaging is such a powerful set of tools to get information, and it doesn't always have to be diagnostic. It may just be added information about severity or what there are complications. And so I think, when the dust settles, let's say in 6 months from now, I think we as radiologists will go, wow, imaging plays this huge role. And yeah, it's not maybe diagnostic, but boy, can it be helpful in who gets admitted, who goes to an ICU, who gets a ventilator, what do we tell family members until lab test comes back? A problem that we've had in the United States is our lab testing has taken so long. It's slowly getting better, it seems, but each market seems to be different in their experience. So if you're facing 5 days of waiting for a lab test, and a CT scan might be able to tell you, well, this looks pretty classic for COVID. It's not specific, but boy, that might help you say, gee, don't go back home where you have grandparents, you have a family member with a renal transplant, and they'd be very, very high risk to have a fatal outcome. So again, I think imaging, it's such a powerful set of tools, and we're going to learn better how to use it from a triage concept, management concept.
Just kind of wondering, with all the different imaging modalities you have available, if you had just one at your disposal, which would you pick to combat the COVID fight, and why?
Well, I'm talking to one of the best ultrasound entrepreneurs in the world, probably. So I should say ultrasound. But,
no, you shouldn't necessarily. No.
I don't use, as radiologists, oddly, we don't use much ultrasound for lung and pleural imaging. But as I am working more and more with emergency doctors, they do, and so getting on a learning curve about that. It sounds like ultrasound has been very helpful at the bedside for the actual ICU physicians in Italy, and being able to do a quick imaging test to tell are things better or worse without having to bring in, let's say, an X-ray into the room, contaminate that machine, expose the CT technologist to that patient. So you have somebody already in a sealed suit in the room, pull out a handheld ultrasound device and just answer the question, is there more or less lung disease that fits the clinical picture, and help them make decisions. So I think in the context of, are you in an ICU? Do you have a really sick patient? Ultrasound may actually be a really helpful tool, and it's so portable now. The logistics around it are much simpler. That said, CT probably gives the most information. We can see the lung really well. We can see the pleural really well, and it's still not specific as we discussed. But boy, your ability to see things, and in the early phases of the COVID infection is when you might see kind of characteristic features that are COVID suggestive, should we say. Later on, the lung just gets so horrible. It's we talk about end-stage lung or ARDS appearance, and that's not specific really at all.
Got it. And I'm curious, with all of your international experience, and the global mindset that you bring to your practice, what are you hearing about the places that you work with? For example, like in Nicaragua, Haiti, how are they handling the crisis? And we hear about Italy, we hear a lot about Europe, and maybe a little bit about Asia as well, but we haven't heard much about emerging economies of the world that are having to tackle this challenge as well.
Great question. So, I wish I could travel because I'd love to go see firsthand, but I read a newspaper article about Nicaragua, and it just sounds like they are promoting social activity and sort of in a denial maybe phase of things. So that's really scary, because that actually is not a good approach to a respiratory infectious agent. I have a couple contacts in Haiti I've talked to. It sounds like they're just starting to see the disease there. I don't know what their testing capability is. I don't know if they're sending lab tests out, let's say, to the United States somehow, or if they're doing local tests. But it sounds like they have proven COVID cases. And, the problem in a resource-poor environment is there's just not enough ventilators. There's not a lot of, physicians who are maybe good at handling, severe ICU cases. And I think the terrifying part is the population density in slums is so high. The idea of social distancing is just kind of fantastical. I've been listening to some, news reporters from India and places. The idea of being able to wash your hands multiple times a day is a real luxury. You have to have clean water, you have to have soap, and for the poorest of the world, that's fantastical. They won't be able to do that. So I think, the terrifying part for a country like Haiti, once COVID gets going, it just could be a massive, overwhelming pandemic, and there's no places for these patients to go. They can't spread out. There's no, high quality healthcare facilities. Most of the facilities are overwhelmed before crises like COVID. So, they think about the poorest parts of the world. I think COVID could just be an incredible horror show.
That is devastating to hear. What do you, kind of in closing, what do you recommend that we, as a layperson, like what can I do both here in my home country and what can I do for those abroad?
Wow. So I think, what we're doing right now, the social distancing seems to be working well. So in a wealthy country where we have individual homes and we can move around in things called cars that are kind of hermetically sealed, we have some fantastic options. And so if we are just disciplined as a society, we may flatten the curve to the point where, only modest number of people have the disease at any point, and our healthcare system should be able to handle that fairly well. It's going to be expensive, it's going to be disruptive, but we have options. So if we're careful about what we do, if we don't just ramp up the economy quickly and tidal wave back into, crowded environments like restaurants or stores, I could see the United States doing okay. I think, 6 or 12 months from now, when we look back, we'll say, well, New York is a really unique environment. The subways, having been to New York a bunch of times, the restaurants there, the stores there, everything is so much more crowded. And when you're talking about a respiratory droplet spread infectious agent, well, that's the kind of way you could spread it effectively. A slum environment, a high density environment, mass transit environment is going to be, that's a good mechanism for spread. So if the rest of the country can somehow, make do with the current social distancing, maybe we'll have to explore with how you have limited return to work, return to school, we may do okay. So I think that's maybe the personal, what we as individuals can do. What we're doing now seems to be helping a lot, maybe. On a bigger picture, I think we'll look back on this and go, why did the richest, most technologically advanced, highly informed society not prepare well? I think a lot of people are going to do the political spin, and we did or didn't, but I think, frankly, no, we didn't prepare well, and there should be some lessons learned. And hopefully we don't spend too much time pointing fingers, but rather, we have to think about how we can organize our actual healthcare system into something that's integrated and can respond as a whole. It's an interesting thing to think about. If we have 1 million ventilators in the country, we don't need a lot of them in Kansas right now, but we sure need a lot of them in New York. And if we were an integrated healthcare system, let's say with the Ministry of Health, that could be done. We could move all the ventilators to New York, everything would be fine. And as they finish their curve, we can move them to Kansas or to LA or wherever the next surge of disease is. But we're not an integrated system. We don't have leadership. And into that vacuum has stepped a very politicized government. And we sort of have this mess of slow response, and it's unfortunate. So hopefully on the other side of this, we'll, as a nation, think about how can we better lead healthcare and maybe have it actually led by physicians and experts with clinical knowledge.
Well, I, for one, thank Dr. Schmit for Minister of Health, the first one in the U.S. That would be awesome.
Thank you.
No, truly. Thank you so much for sharing your expertise with me, and for helping our team understand a little bit more about the context of the crisis, not just here but globally. I think that's really, really important. And thank you for letting us rely on your expertise. I know you advise us a lot, and we're grateful for you and for all the expertise that you can bring to us and to the rest of the world. So thank you.
You're welcome. It's been a pleasure talking, and hopefully we'll talk some more.
Definitely. Look forward to the next conversation. Thank you so much.
Absolutely.